Hello, I'm Dr. Richard Gangwisch. Previously, we had posted a video on crown preparation. Well, today we're going to take that crown and actually place it on the tooth. I've got the video in front of me, so we're going to go ahead and turn that on so we can follow along together. Now we start with a lab procedure, and this is a model that we have that the actual crown had been constructed on. You notice that we have a porcelain fused to metal crown. The beauty of the porcelain and the strength of the metal. It's a great combination. Keep the metal real thin, which helps quite a bit. Now you notice here we have a temporary crown that was done previously. Now what the temporary does, covers and protects the tooth, cuts down on sensitivity that the patient may have. Also keeps the tooth in alignment. The teeth drift, and if you don't keep them in alignment, if we get the crown back from the lab and it wouldn't fit. So now you notice the temporary cement. This is very important that we're able to clean that all off, because these crowns are made very precisely, and if they fit the tooth so well to the point that if we have anything in the way, the crown won't go into place. So we go ahead and put the crown into place. First thing we do is we check to see how the contact is in between the teeth. And then notice how that snaps well. We don't want to leave anything open there because food can get trapped in between the teeth. Now we check the margins. We want to make sure everything is nice and even with the tooth. We want to make sure it's not overhanging into the gum. Also want to make sure it's not short. Now we check the bite. That's very important, because otherwise the patient will just be chewing just on the crown itself. We need to have all the teeth in harmony that way. So we go ahead and check with what we call articulating paper. It's kind of like typewriter ribbon. You notice it puts those little blue dots in areas where it's hitting a little heavy. So we're able to use those as a guide, and we go ahead and adjust wherever needed. Take whatever time it's needed to get that just right. At that point, we go ahead and are ready to seat, so we want to polish where we had to adjust. Now these are rubber wheels that we use. They're impregnated with industrial grade diamonds, and they get finer and finer grit to the point where we can actually get a virtually glazed surface at the end, so it works out super. And that's what crown looks like. So we're going to go ahead and cement that in now. We're going to hold that in with a cement. Now we're going to go ahead and take a little bit of de-oiling agent, and the reason for that is sometimes the temporary cement has a little bit of oil to that. So we're going to go ahead and clean any remnants of that off. Then we have a desensitizer. Now, anytime we work on a tooth at all, we're going to have that possibility there could be some sensitivity in the tooth. We want to bend over backwards to make sure that there's no discomfort when we put this crown on. So we go ahead and bathe the tooth in desensitizer. Make sure that we've done everything possible to make this nice and easy for the patient. Now we'll go ahead and dry that off, and now we're ready to cement the crown. Now the crown's going to go into place with a material called glass ionomer, and that's going to set. It'll take a few minutes. We're going to go ahead and let the patient bite that crown into place and give that a few minutes to let that set. And we'll do time elapse so you don't have to watch for 5 minutes while it's setting. Now it's important that we clean it. We'll try to do this real gently to make sure that the patient's comfortable, but we want to make sure that we get every little piece out of there. Yeah, we don't want any remnants sticking in the patient's gum causing irritation. We want to even check in between the teeth. Very common place to have extra cement. Starting to look pretty good at this point, so just inspect, make sure there's no little specks of cement left. Now we're going to floss to make sure all that's clean, and looks great. Patient's happy, and That patient will have that tooth for not only years but decades. It should give her wonderful service.